Thank you. Good afternoon, all. Welcome to today's session. Today's session is psychosocial issues. So I would like to introduce the uh, uh, Ashika George, BSc MSW. She is working as a junior social welfare officer in Paliam, India. Experience of internship in organization like Kasturba Medical College, Manipal District Medical Office, Thrissur, Kerala, Wellcare Hospital in Ernakulam, Kerala. Volunteered in COVID-19 vaccination camp conducted by Rotary Club in association with Kerala Health Department. Passionate about training and social work. Welcome, Ashika, ma'am. Next, Miss Shilpa Johnson, Education BA MSW, working as a social welfare officer in Palim, India. Experience of internship in Palim, India. Passionate about social work and training. I would like to welcome, and I would like to today's topic. I would like to introduce that psychosocial aspect is very much important because we are dealing with the total care in palliative. Like when we are dealing with the palliative care, we have to focus on total care. So one of the aspect of psychosocial is very much important because we are, as a nurse, palliative nurse, we are mostly spending long time with the patient. So finding out the psychosocial aspect will be more important as compared to treating the physical symptoms. Okay, so I would like to hand over the session. Over to you, ma'am.
Thank you, sister. Good afternoon, everyone. So today we are discussing about the psychosocial aspects of care. Let's start with the definition of WHO regarding palliative care. Let's explain what it means. So it's an approach that improves the quality of life of patients and their families. It's not about all patients and their families. It's about patients who are facing problems associated with life-threatening illness, prevention and relief of suffering by means of early identification and impeccable, the faultless assessment and treatment of pain and other problems. The other problems include physical, psychosocial, and spiritual. So, basically, what we intend to do is to improve the quality of life of patients and their families. The patients that we deal with are the patients who are suffering problems associated with life threatening illness or life limiting illness. What we do is we try to prevent the suffering and provide relief to the suffering, and for that we are doing early identification and impeccable assessment and treatment of pain and other problems. The problems that we address not only include physical problems, it also includes psychosocial and spiritual problems. So why is psychosocial care important in palliative care? That's a great question. So let's know more about the importance of psychosocial care in palliative care. So when a patient is living with a life limiting or a life threatening illness, or the patient is aware that the patient is approaching death soon. So in such situations, the patient will be facing unique stresses and challenges in his or her life. So, for giving or for improving the quality of life of a patient, we must understand those factors related to the patient's quality of life for providing appropriate care. So, what we intend to do is to make a social diagnosis of the patient. The social diagnosis not only include a physical factor that we identify, we try to understand the psychological, biological, social, and environmental factors operating on that patient during the time of this illness. So, a serious illness always disrupts the individual's thoughts and feelings. It always affects the patient's relationships, social and spiritual supports, and financial stability and spirituality. So what we try to do is we address each and every factors that we have discussed right now for improving the quality of life of the patient in a palliative care setting. What is total pain? The term total pain means when a patient reports his or her subjective pain on the pain scale, we must be aware that the physical pain reported by a patient is compounded by his or her current life circumstances. It's not always the physical pain. Maybe the patient is having thought that the caregiver, it could be his wife, or it could be her husband, or it could be their kids, or whoever they are taking care of that patient. They might have a feeling that I am becoming a burden to my family, or I was the only earning member of my family. Now the financial stability of my family is not stable, and I have such issues, or my kids education is now a question mark. So many tensions and many problems are surrounded by this illness, and that also complement or compound to this patient's pain. So what we try to address is the total pain. As a clinician, it is our responsibility to assess the contributory factors that leads to the total pain that the patient reports to a healthcare professional. So that's what we are discussing into detail. The illness-related suffering, it is much more than just the physical distress, as we explained right now. So this total pain, it can be divided into four categories. It is physical, psychological, socio-economic, and spiritual. These four aspects contribute to the total pain of the patient. So the first thing we do for improving the quality of life of the patient, or to make the social diagnosis, is assessment. This is the first step that we do. So the aim of assessment is that we must identify the problem areas which result from the illness for that patient, and that problem areas may also influence the well-being of the patients and their families. So what we do is we try to identify which all are the problem areas associated with this illness for this patient. This assessment involves two steps. We collect the information, and then we identify and honor the strengths, resources, and needs of the patient. And another important thing is that the assessment is always an ongoing process, because and also the selection of goals and interventions that we are taking for that patient, it depends largely on what we assessed about that patient. And we also told that it's an ongoing process, because the psychosocial needs of the patients and families or caregivers often change over the course of illness. Maybe the patient gets an admission for pain management, but after the pain management goal is achieved, the patient might be thinking about having an income for the family. So we might go for a vocational rehabilitation. So the patient's needs and concerns might change. So that's why we are telling assessment is always an ongoing process. It must be continued throughout the treatment in a palliative care setting. So what all are the sources of information? We told that we need to assess the patient, and how all we will get the information for that. Sometimes the source must maybe the patient or the caregiver, and we also have collateral sources. It could be friends, relatives, neighbors, and a major part of, or a major source of information is home visit, because a full assessment can only happen in the home care setting. When we visit the home, it will give much more clarity to us regarding the assessment. Areas of assessment. These are the major areas that we assess in the case of a patient. Patient and family overview, insight, family structure or dynamics, socioeconomic status, environmental assessment, psychological distress, spiritual impact of illness, and interventions and plan that we take. So we are going into detail regarding these areas of assessment. First one, the patient and family overview. In patient and family overview category or area, what we focus mainly are the basic demographic details of the patient, like the patient's name, age, gender, etc., and other major details. And occupation the patient had before the illness and after the illness, and who is the primary caregiver of the patient, and what is the relation between the primary caregiver and the patient. About insight, we will assess about the insight of the patient and the family or the caregiver regarding the diagnosis, prognosis, and palliative care. Sometimes a patient might know what is the disease. They might not be knowing how severe it is, or is there a chance of curability, or such aspects. And sometimes the patients are not aware about what is a palliative care. In my experience itself, I have seen many patients who consider palliative care as only a case that we approach as part of end of life care. Many of the patients doesn't know for what all we try to approach a palliative care setting. Sometimes the patient doesn't even know the diagnosis at all. And so in that case, we try to assess the insight of the patient and family regarding diagnosis, prognosis, and palliative care. Family structure and dynamics. For understanding the family structure and dynamics, we have a tool called genogram. And regarding the family dynamics, we would like to explore the support systems available for a patient. In that case, we use a tool called EcoMap. We will go into detail regarding these two tools and history of illness in the family. Sometimes a patient might be having a history of this particular illness in the family. So we might also explore that part also. So these are the things included in the family structure and dynamics area. So now let's learn more about genogram and ecomap. Shilpa, over to you.
Thank you, Ashika. So now we can look into what is genogram and its basic structures and all. So genogram is also known as a family tree, and it was invented by Murray Bowen. Basically, it's a graphical representation of a person's family over at least 3 generations, which tells us about. So basically, in a genogram, we should include at least 3 generations, like their structure, their dynamics, their strength, and their resources. So the major types of informations in genogram will be such as their name of the entire family will be provided in a genogram, as well as their age category or their educational qualifications or what type of education they are pursuing or what is their occupational profile and different types of emotional relationships. So basically, it's a graphical representation which usually shows their structure, their dynamics, their resources, etc. So now we can see some of the symbols. These are the typical symbols that we used in the genogram. Like in order to mention the gender, we use a square for a male and a circle for a female. And if they are married each other, we will just connect them with a single line. And if both of them are separated, we will use a slash line. And if they are divorced, we will use a double slash line. So these are the basic symbols that we are using in a genogram. And the next slide, we can see some of the symbols like related to children, pregnancy, twins. And these are some of the basic symbols that we are using in a genogram. And I think it is available in the Google as well. You can have a search if you are in need. So next, we can see the emotional relationship. It is an important thing that we should consider while preparing a genogram, because through this emotional relationship, we can understand what is their dynamics with each other. And in this emotional relationship, we are mainly denoting like some of the lines are using like a plain. In order to represent a plain or normal relationship, we are usually using a single line. Or in order to represent a friendship or close, we will use it as a dotted lines. In order to represent an intimacy or very close, or hostile or a conflict or a violence, we will use certain kinds of lines to represent their emotional relationship. And also with the case of if they are having an emotional abuse between the partners or between the family members, we will use these symbols. So through this emotional relationship, we will get a clear-cut idea regarding whom we should rely in a family or with whom we should collect the information. So next, we can see a basic genogram representation, which doesn't have any relationship. It is a very plain genogram, you can see. And here, the patient is called Sindhu, which is shaded in a slashed line. I think you are all able to see that. And she's of the age 40. And she was married to a man called Raju, and he's no more now. And her second marriage was with Shaji. And in her first relation, she has a child called Saran. And in her second relationship, she has two twin boy child like Amal and Vimal. So this is a very simple genogram which doesn't show us any relationship, such kind of things. Only their name, their education, or their work, or their age, such a kind of things are being represented. I think you all get an idea regarding the symbols, regarding the signs and all. Now we can move into another example of a genogram, which shows everything related to that family, which includes the relationship between each other. And you can see that it is basically representing a 3 generation. Maybe that Sindhu is the patient and her parents' details are being shown, her children's details are being shown. So 3 generation is being represented here. And you can see that within that circle, Sindhu lives along with her husband, Shaji, and along with their children in a single family. So Sindhu is our patient, which is shaded in a shaded line, and her husband, first husband Raju was died. He was a coolie worker, and her second husband Shaji. So we can see that Sindhu is having a very close bond or a very close connection with her sisters called Bindu and Indu, which is represented in a green line. And she's having, and also Shaji, her husband, is having a very hostile relationship with his brother as well as brother's wife, which is denoted in a red color. And also with the case of Shaji, he's having a very plain or normal relation with his children like Amal and Vimal, which is shown in a plain line. And with the case of children, like Amal and Vimal are having a very weak relationship with the stepbrother. So within this genogram, we are able to see the entire family, their structure or their dynamics, their relationship with each other, how the things work in a family and all. I think you got an idea regarding genogram. So we can move into next slide. So ICOMAP, another important area that we are addressing in palliative care, especially in psychosocial aspect, is ICOMAP. And ICOMAP is a pictorial representation of a patient's family in its social environment, like to show the relationship with a larger society. And also, it is also called a snapshot view, and which shows the importance of interactions of patients' family with other systems like groups, extended family, individuals, organizations, associations, etc. Basically, this ICOMAP shows the relationship with the larger society. And next slide, please. So from this, we can see that these are the major support system that a patient or a family can available from a community. Like here, we can see the family in a small circle, and they are able to get several support from an entire local support system like workplace, neighbors, health services, volunteers, schools, clubs, etc. So this is just a thing that with what kind of support that a patient or a family can avail from a community. Just an example. Now we can move into an example of ICOMAP so that you will get a clear idea. So next slide. From this, you can see that a family is being represented in a genogram, a husband, a wife, and their both children. So here the wife is the patient, and here the lines which shows the relationship. If they are having a very positive or normal relation, we will use it by a very single line. Or the relation is very weak, we will use it with a dotted line. Or whether sometimes they might have some stressful or hostile relationship, will be used that line. And here we can see that the entire family is having a close bond with the church. They rely on each other, like from they get a support from church as well as the family is very close to church. So we are giving a very bonded line in order to show the relationship. And with the case of self-help group, the patient, she is getting a help from the self-help group that is not in a single arrow, and she rely on self-help group. And also with the case of the husband, he is very much close, like having a very positive or normal contact or relationship with the colleagues. And in case of public health center, they are not in a very good connection because we can see that if that weak or daughter line is being represented, maybe she is not getting any health service from the PHSC, or she is not getting any type of support from the PHSC. So the relation is represented in a weak way. And also the college, the elder son is studying in a college, and he's having a very close contact or a very strong relationship. So it is from college, they are relaying each other, that is being represented. And both the children are having a very normal or very positive relationship with the friends. And the younger doctor is getting some support source from the school, and the youth organization is being relayed on. And with the case of volunteers, some of the volunteers in the community are helping the entire family in one or the other way. And with the case of neighbors are having a very stressful relationship or very hostile relationship with the entire family. and with the panchayat member, very weak relationship. So from this, we can see that how much support system a family is getting from an organization or from a local support system. So now we can move into next slide. Caregiver, another important aspect in palliative care as well as in psychosocial care. So there are only 4 kinds of people in the world: those who have been caregivers, those who are currently caregivers, those who will be caregivers, those who will need a caregiver. So in palliative care, both the patient as well as the caregivers are having a very important role. We are treating them equally. Like, since the patient is having their own physical problem, but with the case of caregiver, they are also having certain burden. Like, they are the one who looks after everything, even the patient, the family, and everything. So we equally give importance to caregiver as well, and we should respect those individuals. We should acknowledge their complex role. Never dehumanize them by calling them bystander. In our system, we are having a very bad, very bad way of addressing the caregivers by calling them bystanders. But in palliative care approach, we are using the term called caregivers, and we are giving them such kind of respect. We are we are treating them equally like a patient itself. So somehow in the entire life cycle, we all are there to be we will become a caregiver once in a way. That's sure. So caregivers are much important, and they are treating like same. We are giving same importance for the caregivers as well as patient in the palliative care setting. And now we can see a video which shows some support, or which shows some support by the caregivers, or how caregivers are looking after the patient in a palliative care approach. Video. There's a small video which shows the importance, like how a caregiver is treating the entire family by becoming independent and all. Now we can move into another important topic that we deal in psychosocial care of palliative care approach. It is socioeconomic status. We do have a detailed assessment over this, like the socioeconomic status, whether in order to know regarding whether they are getting the adequate food, or whether they are having enough clothing or shelter. And regarding the breadwinner, like who controls the finances or the source of income. Like, for example, if the primary breadwinner is affected with a disease, maybe the source of income will be delayed. So we will look into that also. And regarding debt, whether they are having huge debt, or whether they are getting any social support like the government schemes or any other local financial support. And regarding the children's education, within this, regarding these many factors or these many areas are being assessed in a socioeconomic status, and we do get a clear-cut idea, and we plan our interventions, or we do have a idea regarding how much economically they are weak, or how much they are capable to do their daily living activities. So this is another important area we do take assessment. So moving to next slide, it is all about the environmental assessment, like the type of house that the patient or the family lives, whether it is an own house or a rented, or whether that house needs any repairing works or not, and the position of the patient in the house, overcrowding, ventilation, or light, and regarding the kitchen, whether they are having a good waste management disposal, or open food storage, and regarding the water supply, whether they are getting enough water, like what method of water collection they are using, or the mode of transportation in order to collect that water, and the access to main road, hospital, pharmacy, grocery. So we will be having a detailed assessment regarding all these things. So these are the basic things that we look into the environmental assessment. Now moving on to next slide. psychological distress. So this is another important area that we are dealing with. Like the areas of psychological distress include the mental health. Are you able to hear now? Can someone? Okay, thank you.
Yes, ma'am.
Okay, thank you.
Yes, ma'am.
So another important topic, like the psychological distress that we are dealing in palliative care. So the areas of psychological distress include the mental health, emotional well-being, anticipatory grief, and coping mechanism. Like in a health condition, we are addressing the physical pain, the social problems, and with regard to that, the psychological distress is also being addressed. And it is not an easy task, or it is not much evident in a patient's life. Like all of a sudden, a patient is switching their role to a caregiver, or if sometimes they get diagnosed with the disease, they are all of a sudden switching their role. So obviously they will automatically have some kind of mental health issues, or the emotional well-being is being affected. So we are addressing that too in palliative care approach. And some of them may use some coping mechanism in order to get a relief from such a kind of psychological distress. And some coping mechanism may affect them positively as well as negatively. And there are many coping mechanisms that we are using here at palliative care approach. And these are, so in this psychological distress, we basically, the social officer will do some initial assessment. And sometimes if they are in need of some further follow-ups or further session, we do refer the patients or the family to our psychologist or the psychological department. So moving to next slide, spiritual assessment. It is also another area of our assessment. And as we all know, it is not something related to a religion, beliefs, or something like that. It is related to our understanding of meaning of life, or meaning of the existence, or our requirement, something like that. It is not something related to a religious beliefs or like that. So our connection, or our strengths and comfort, hopes and concerns, meaning and joy. And in spiritual assessment, next slide. In spiritual assessment, the main areas of assessment such as with regard to connection, like we are asking who are the persons or the communities you look into for the support, or what role do they have in your care, or do you have an image of a power greater than yourself, or your faith or your relationship. And with the case of meaning and joy, we are mainly addressing that what has been the most important in your life, or what are you most thankful for, or what makes or has made you happy, or what do you feel the proudest in your life. These are the certain questions that we are asking them during our spiritual assessment. With regard to strength and comfort, we will be asking them, is there anything that is comforting to you now, or what helped you to get through the difficult times in the past, or who or what is your source of strength now. And with regard to hope and concern, is there anything that you hope? Is there anything that feels unfinished? So in spiritual assessment, it is not an easy task to address. It is a very but it is a very time-consuming process. We cannot do it in a very initial assessment or 1 or 2 sessions. It's a gradual, ongoing process in the palliative care approach. Moving to next slide. These are the major interventions or the support system that we are providing in palliative care. Like we do a detailed assessment for the patient as well as for the family. And then as per our plan or intervention, we provide them certain information with regard to such and such things. And we do license the a patient or the family with some other government schemes or something like that. And also we give certain facilitations and rehabilitation. So in palliative care approach, one of the main aim or the important thing is that making the patient or family independent. So through this rehabilitation process and all, we do make the patient or the family independent to do their daily living activities by themselves. So this is one of the important interventions that we are doing it right now in palliative care. There are many such kind of rehabilitation process that we are adopting. And another important intervention is like bereavement support. once the patient is no more, means there is no support. It is not that our support is not ending there. We do have the follow-up calls, or we do have the bereavement support visit or the bereavement calls for the patient's family as well as for their children. And also we do have very good follow-up sessions. If they are in need of such some kind of supportive counseling, we do refer to the psychologist. And these are the some of the major interventions that we are providing at palliative care right now. So assessing psychosocial or spiritual suffering. We know that assessment is an ongoing process. It's a gradual or ongoing process. So it is a never-ending process. So in that case, we, being a social worker or being a palliative care provider, we should have certain purposeful observations with the patient or the family, because some of the non-verbal actions are more, so sometimes it might give us more information than any kind of assessment. So we do have certain purposeful observations and purposeful conversation. So it's our duty to initiate certain conversation. Like during our assessment, we do build rapport with the patient, but it is not necessary for the patient to open up everything before us. So in that case, we purposefully initiate certain conversation in order to get a clear-cut idea regarding that patient's condition or the family. So it is a very much, this purposeful observation as well as purposeful conversation is very important in palliative care, psychosocial approach. So assessment. If our assessment is inaccurate or if it is an incomplete assessment, which will lead to an inappropriate call or an interventions. So it is very much important, or it's an inevitable part in the psychosocial care to have an accurate or a complete assessment in order to have an appropriate goal and intervention. So assessment is an ongoing process. Yeah. So next we will be dealing with a case study, and over to you, Ashika.
Thank you, Shilpa. So here we are going to discuss a case study. So let me read out it for you. A 56-year-old lady, Mrs. A, has been diagnosed with CA breast in 2016. She had undergone mastectomy, the breast removal surgery, referred to pain management. She looked very anxious and had no idea about palliative care. She had these kind of comorbidities: diabetic since 12 years, coronary artery disease, fracture on leg due to fall in 2019. She is a widow and her children are having a hostile relationship with her, lives alone in a rented house. So I request you all to just go through this case study for a 1 minute and we can discuss about it soon. Okay, so what are the important areas to be assessed from the point of view of total pain? We said that the total pain is not always physical. Okay, what I said is that just go through the case study and we can discuss in detail about the 4 aspects of total pain regarding this patient. We told that pain is not always physical. It includes physical, psychological, socioeconomic, and spiritual. So after reading this case study, we can discuss about the 4 aspects of pain in the case of this patient. You can use the chat box or you can unmute yourself and contribute like what are the physical aspects of pain or psychological aspects of pain, socio-economic and spiritual.
I think that she is having some problem with the removal of breast and we'll have to introduce some processes or something to and we'll have to give some psychological support education regarding the everything that surgical management and post-surgical management and everything. We'll have to give some
Yeah, you are
good
right.
education regarding the
Yeah, you have detailed about the physical aspect, one of the physical aspect. And here in chat box, we have the psychological aspect like hostile relationship with her children, living alone, and again the hostile relationship with the children. What you all have said is right. Is there anyone else to discuss about the spiritual part and the socio-economic part? Yeah, she's a widow. She lives alone in a rented house, and she's having disease as well as many comorbidities. So her socioeconomic status will be poor. Yes, she will be having financial crisis. And regarding spiritual, yes, she's anxious. Again, the socioeconomic aspects. We need to find out the source of income. Yes, you are right.
and we have to reduce the stress and we have to look after about the diabetic and the coronary artery diseases conditions because when the patient is get stressed and anxious, it will be increased.
Yeah, you are
And
right.
we have to manage that conditions too.
Yeah, we need to address the comorbidities as well. What you said is right.
And
Anybody
we
else?
have to, as a healthcare workers, we'll have to keep a good rapport with them, and we have to give the clinic or any other places, and we'll have to communicate with every monthly or even monthly that in our country we have some clinic and we are discussing about their ongoing process monthly like, and we are giving a good support and we are keeping a good communication between them even by the phone. Sometimes we are asking by using the phone, how are you now, how are you getting on, and you did you had your
Yeah, you said about the follow-up actually. That's also true. And here, one has commented about the social support that we need to develop for the patient. These all are right. Anybody else? Or let's go into detail regarding the total pain that you all have explained right now. So what are the important areas? These are the areas of assessment along all those four parameters. As many of them are told about the patient has undergone mastectomy, she's having body image issue. She also had other comorbidities. There are difficulty in walking. She is anxious, so there could be lack of sleep, fatigue, physical pain is already there. And regarding the psychological aspects, mm, there will be isolation. She's living alone. She's emotionally weak, anxious about the future, unclear about her prognosis and palliative care. In the case study, as you have heard, she's aware about the diagnosis. We haven't mentioned about the prognosis. She's not aware about the palliative care. That is also we have mentioned. And also distress due to the comorbidities, as someone of you have mentioned. And regarding the socioeconomic, we have told about she's having strained relationship with the family. She's unable to go for job. She has financial instability. House is on rent, and she has low accessibility to hospital, absence of caregiver and support system. This comes under the socio-economic part. And regarding the spiritual, she could be having a thought, why all these sufferings to me? When we are thinking on her point of view, she is a widow, no one is there to support her. She's having a major disease and also other comorbidities. She lives alone, so she could be thinking, why all these sufferings are for me? Or she could having a loss of faith in God. and she's having loss of connection with family. There is no significant person in her life to at least open up. There is no memorable or joyful events in her life. When she is looking to her life, she can see that everything is being problematic. So these are the spiritual parts that we can address. Some of anyone has mentioned regarding the church, if she is a Christian, that's also a social support, or it is connected to spirituality. Counseling the children, that is also one of the interventions that we can provide. And next, we can discuss about the possible social impacts that an illness can cause to a patient. As we have discussed in this case study, it could be social isolation. Sometimes a patient might feel that he or she is dependent on her family, or sometimes dependency may arise due to the patient's situation. There could be financial instability, lack of social support. There could be debts. It could be because they have already taken some debts, or because of the treatment they could have taken debts, and loss of work. There could be interpersonal issues with the families, friends, or other factors, or there could be inadequate facilities to address the illness. So these are the major possible impacts that are caused because of an illness. Next, we can go look about the possible psychological impacts of a patient, like the feelings of shock, uncertainty, hopelessness, the anticipatory grief that develops regarding what is going to happen next. The patient is developing a grief on that, and poor insight about the illness, anxiety. Sometimes we might come across patients who are having suicidal ideation or wanting to hasten the death. I still remember one of the patient who came for registration under me, and what he said is that his son is already bedridden. He's having debts. His wife is also having some illness. He is suspected to have cancer, and he opened up me like, I am planning to commit suicide because I don't want my wife to suffer anymore. I don't know what my son will do, or who will look after my son after my death. He told me that he's completely shattered mentally because of this anxiety, that if it could be cancer, and poor coping with the illness. Sometimes a patient might not be able to accept it. And these all are the major possible psychological impacts that could be affected for a patient regarding an illness. The psychosocial and spiritual suffering is real, but can be difficult to recognize and treat. They sometimes manifest it as physical complaints. So we need proper training, and we must be open or ready to address those issues also, because sometimes it can be manifested as physical complaints only. Next, we can discuss about the vulnerable populations that we come across in a palliative care setting. Sometimes the patient could be living alone. There is no one to look after the patient, or there is no one to address the patient's needs on an emergency. And elderly without any support, single parent, multiple patients in the family. Sometimes it could be a genetic one. Maybe the parents are having the illness, the children are also having the same illness. Victims of gender issues like domestic violence. It could be physical, verbal, psychological, or sexual harassment. Individuals with mental health issues, individuals with suicidal ideations, socially isolated individuals, substance users in family, and individuals in extreme poverty or like lack of food, water, shelter, etc. So these are the major vulnerable populations that we come across in a palliative care setting. Dignity. What we need to give a good importance in palliative care setting is to identify or understand that the patient is an individual with his or her ideas or viewpoints or thoughts. He is also or she is also an individual, and we must understand and respect their individuality. Being a patient doesn't make him or her inferior to us. He is also or she is also a person who lived a life, a meaningful life, and when an illness comes, a patient is having compared to the previous life, a patient might having a poor quality of life, and we are the ones to improve the patient's quality of life, and we must do that by respecting the dignity of the patient and also by understanding the individuality of the patient. So this is one of the photographs, or this is one of the incident that happened in our organization. This couple have never celebrated their wedding anniversary, and this patient was admitted for the goal of end of life care. The patient was approaching his last days, and during that time the wedding anniversary was there, and it was their wish to celebrate it together even in that time. So what we did is that we understood their concern or need or their wish, and we in a cooperation we tried to make it true. And after this event, within 2 or 3 days the patient passed away, but they had a meaningful or a memorable moment before his death. So in this way we must try to identify the patient's needs and concerns beyond medicines and treatment. This is the vocational rehabilitation that we have provided for our patients. Like we have provided goats for goat rearing and candle making. We have provided sewing machine for the patients, and like umbrella making and all. So what we do is that sometimes a patient have a feeling that they are becoming dependent on us, or it could be even on us, or it could be on their family, or sometimes even the patient's relatives or family could abandon the patient during the illness. So the patient sometimes have a dependency feeling. What we try to do is try to make them independent as much as possible by providing vocational rehabilitation help, so that they could earn a living for themselves. So it might change their life much more. They are at least they are getting engaged on something. They are not having any distressing thoughts or anything else. They try to find a meaning to their life. And these are some of the services that we have provided as part of vocational rehabilitation. Next is support for children. It could be educational or emotional. We are providing education support for our patients' kids, and also sometimes the kids are also our patients. We provide education support. What happens is that if a patient is ill in a family, sometimes a child may not be enjoying the pleasures or privileges that other family kids are getting. It is very evident. What I came across is that we had a summer camp here. It's named as Kuttikutam, and during our summer camp, we had a trip for the kids. We had some sessions for the kids. They were with us for 3 days in a hostel setting, and at the end of the before the end of the camp, we had a trip. It was to a nearby mall over here, and also we had a movie in the mall. And the last day, one of the kid had said, I think she is 15 or 16. But what he said is that he has never seen a movie in a theater. He has never went to a mall. So such pleasures are neglected because there is no situation in the family to address the kids' needs or wishes. So always, sometimes the children are suffering. Sometimes the caregiver is the mother, and the caregiver is giving more attention to the father or her husband. So the kid is not getting proper care or attention from the family, or the kid is not getting good social support from the nearby places. So always we need to address the kids also. Here, what we provide is we provide education support for the kids. We provide mentoring programs for the kids, and also we arrange camps and all. In that way, we try to support the kids of our patients. In a palliative care setting, what we need to always remember is that evaluate our interventions. What have we done for the patient's wellness, and how it affected them, how they are benefited by what we have done. And also, we must always revise and update our assessments, and we must always provide an assurance for the patients to reach out for help if needed, and we must be ready for that. And there is an art and science and psychosocial care just as in medicine. So we must always be ready and willing to provide a good quality of service for our patients, and thereby improve the quality of life of the patients. Thank you.
Thank you, Ashika and Shilpa ma'am, for the session. So I would like to like I would like to participate all the participants should participate by not on the chat. I want your answers. What is the take home point you got from this session? If you can on the video also. That's an humble request from my side.
Hi, madam.
Yeah, okay. What is the take-home point you got from this session?
Okay, what I get is like, how do I address the patient's problems? Mostly, I'm very new to palliative, but I just recently only joined. So after I joined, the first course I'm taking is from you guys, and from the today's session, mostly for the pain, total pain, I do understand how do how do I address things from patient, like the questions that I can ask, and then what the answer that I can expect from them, and in order I can provide what they need. Most of it like that. Thank you.
Okay. So, in order to make it more clear, like in the psychosocial issue, what is the major point with your experience? Like you said, you are just new into the palliative care as a palliative care nurse. So, what is the new thing which you got from this session, which is a take-home message?
Um,
One thing is, in order to improve the quality of life, we have to focus on total care, right?
yes.
Right.
Right.
So, in order to attain the total care, you have to think about four aspects. What are the four aspects? Anyone else?
Physical, social, industries, and psychological, spiritual.
Okay.
Yes.
Okay. So, right. So, psychosocial, the two terms we are focusing, psycho and social. In order to attain the psychosocial aspect, we have to look into the patient's physical and mental, both, right? Physical and mental, both things has to be addressed. And in order to attain the social goals, we have to focus on the economic as well as the spiritual background, right? So then only we can get the four aspects together and we can focus and we can improve the quality of life, right? So that's why we are like in the starting the session also, I have said that this is an important session. Okay, any other take home message? The take home message?
Madam, I have one question.
Yeah.
Under spirituality, what
Okay.
are the questions usually we can ask to the patient in the aspect?
Okay, you can ask that how frequently you used to go before you got the disease. You usually visit the temples or churches. You can ask one question that, right? So
Okay.
that will be more like getting hitting a point, and you will get most of the point, right? So with this question, you will get many answers. What all answer you can expect from that patient?
Maybe previously they attend the temple daily
Yeah,
or
earlier I used
follow
to
all
go
the
always,
fastings and
right?
everything. Yeah.
Yeah. Thank you. So earlier I used to go frequently to the temple, but after the disease I didn't go. So that one point will be connected with the other question. Why did you stop going there? So he will tell that because of this disease condition. Why me only? So these kind of things or answers you will be getting. So with that one question, you can ask many questions related to spirituality. Why you are thinking about that, so we can like go into the psychological aspect also, why he is thinking, what made him think like this, because only because of the disease condition or because of his physical like physical disability he is going through the disease, right? So these all will be interconnected with each other. So there is not a specific question we can ask. That is the only thing is what kind of spirituality you had earlier and now what you are dealing with, right? And he will be saying that I am in a great grief, because why this, he will be mourning why I am the only person who is suffering. So we can tell him that not this is the only thing you are suffering. There are many persons. You can not, you don't have to say the names, but you can say there's like simple examples, right? As a human being there are many things which we go through, right? So all things has a solution, so we can do a solution. Whatever disease he is suffering, we can solve him whatever by focusing on the four aspects, right? Okay.
Thank you.
Yeah, thank you. So I got only one take home message. Another take home message?
There is one in the chat box.
Okay, caregiver deserve the same respect and acknowledgement as patient. Okay. So in palliative care, we are not only dealing with the patient, we are dealing with the patient and family, right? So the caregiver who is involved in the patient care, he will also have his all of the four aspects like not balanced, right? So we have to balance it. So so not only the patient, we are looking into the caregivers aspects also, right? Then another take home message. Shall I say the name? Okay, Haripriya ma'am, can you can you give one point or a take home message, take home point you got from the session? Haripriya ma'am.
Yes.
Yeah.
Yes, ma'am. Already said, ma'am. I thought
One point which you feel that is different. Any one point.
the rehabilitation we have given.
Yeah, very good. The rehabilitation which is given, vocational rehabilitation in order to
I have to.
face the patient even if they are in a hard phase of their life. Yeah, very good. Any other? Genogram, you know, everyone know about genogram, ecomap. That is, I think that is, you may know about it, but by giving the elaborate explanation, that was a big take home message. How to like track the patient, what is the family details of the patient. Without knowing that, we cannot get into the like psychological or financial or any aspect of that in total pain, right? Okay, in the chat box there is a different type of genogram. Okay. Okay, anything else? Thank you, ma'am. Anything else? Okay. Uh, which I found it more important was psychosocial distress. We are focusing on mental health. We are focusing on emotional well-being, anticipatory grief, and coping mechanism. So, like coping mechanism, do you think it is important? Yeah, do you think it is important? Coping mechanism is important. Yes. Then why? Why? Why it is important?
Because when they have to leave.
Ma'am, you are not clear. For the better mental health. Yeah, exactly. I got an answer. For the better mental health, we need to improve the coping mechanism. We, as a normal who is like who is not having any kind of disease, can have the ability to cope up with any situation. But with one fever attack or one cough, right? Once you get the cough also, you will be able to cope yourself with the environment you are dealing with. No, right? So same wise only the patient who is going through a suffering will not be able to cope up with the any of the situation. So in order to cope up with that situation, we have to support them psychosocially. So in palliative care, we are mostly focusing on, like not mostly, we are focusing on all the aspects, but this psychosocial issue is an important factor that has to be addressed in order to improve the quality of life of patient and family. Okay. So all this we need in a palliative care setting, we need a team also. Without team, we cannot do anything. So team is very important. Team has to be there. So who all are included in the team?
Space, madam.
Hospice. Okay. Who are the members of the team?
Nurses and doctors.
physiotherapist, nutrition.
Who took your session? Session is taken by whom?
Social worker.
Yeah, social welfare officers. We need that persons, right? We need the team which includes social welfare officer, a physiatrist, okay, and palliative care physician, palliative care nurse, everybody we have to involve with. And importantly, who will they can assess everything, but we are more together. Like palliative care is more like approachable to the patient 24 into 7, right? So we can also explore many things. Okay, so that was the session, psychosocial issues. Anything else if you want to ask, you can ask.
One has commented regarding the assessment, importance of assessment should be revised and updated. And also other one has commented regarding to take care of the patient's mental, physical, psychological needs, and also to look into the rehabilitation purpose of the patient.
Yeah. So why we are looking into the rehabilitation aspect? Rehabilitation, why it is important? I'm just asking it so that I may also know that what all things you are taking away from after this session.
Mind relax.
Yeah, mind relaxation. Yes, and
Quality of life.
yeah, the only one word, the quality of life, that is we are achieving, right? So if quality of life is improved, everything is improved. Thank you so much. So this was the session. Hope you have all understood the session. If any queries, you can ask in the chat box, WhatsApp chat, or you can, you may have, I think you have email ID, you can ask in that, right? Okay, thank you so much.
Thank you, madam.
Thank you.